And we are live. It's Dr. J here in the house. Let's dive into a live Q&A session here today. So what's going on? Let me know your questions. I think we already have some up in the queue. Let's see what we got. All right. All right, excellent. Akbar asks the same question every week about the parrot and the silver. Finish it up and let's schedule a consult to chat about the next step. Finish it up and then we'll chat at the next step. If you've been taking it more than 3 months, stop and pause and we'll chat soon. All right, excellent. Let's keep on rocking and rolling. Lisa wrote in, how long do I need to stay on the supplement after completing the GI clearing protocol? I'm not sure what supplements you're talking about. Are you talking about adrenal or female hormone support? It really depends on what you're talking about. But in general, we would have you on the clearing herbs for anywhere between 60 to 90 days. And then if there's adrenal or female hormone support in the background, we'd have to follow up on that and talk about retesting and make sure things are under control and stabilized before we pull you off. Lakshmi writes in, my daughter 19 gets menstrual cramps and vomiting after her first day of period. Yeah, so there's definitely a lot of estrogen dominance going on, right? Definitely a lot of estrogen dominance. Have to dig deeper in with that, figure out what the underlying cause of that is. But again, diet's going to be an important component. Inflammation, and then of course, most women I'm seeing these days have a lot of estrogen dominance, lower progesterone, and that's a big problem. That's a big issue. Elizabeth writes in, Dr. J, and is there a particular order that is best for taking your thyroid supplements, vitamins, brain replete, Mito, or GI? Well, thyroid support always is taken 30 minutes before food. And if we have any absorption issues, we may take that and put it in our mouth and hold it sublingually for maximal absorption. But for the most part, anything else on the nutrient, amino, vitamin, mineral side can be taken with food or even away from food as long as it doesn't cause any nausea. If it causes nausea, take with food because then it gets assimilated and mixed in with a lot of your nutrients and then it just gets absorbed together. And then, of course, the GI clearing is going to be better taken a few minutes before. But if we have any issues on that or it's too potent, we can do it with food so it mixes and kind of becomes a little bit better assimilated and a little less potent. And then, of course, enzymes and acids are better taken with food. I tell patients that you can take enzymes and acids before or even after a meal, but there's a greater chance that there could be a side effect. So I always tell patients, take it in the middle of the meal first, get comfortable with it, know that you can do well with it, and then if you try it another way and you have an issue, then you're on top of it. You know exactly what caused the problem. Liz wrote back again, what's your take on coffee with gut issues? I've been having, sometimes I can tolerate it, sometimes I can't. So yeah, if we're on an autoimmune template and we're having gut issues, as I sip some of my coffee here, um, definitely pulling the coffee out for a few weeks to see if we notice a correlation is great. I mean, you can always throw in a simple tea instead. That's fine and see how you do. But I think if we're on the fence about it, which it sounds like you are, I would definitely control for some variables on that and see what happens. See if that makes a difference. All right, cool. Sarah writes in, my sister recently got an itchy small rash on her face. What can she do to get rid of it? She says she hasn't eaten anything new, and what could have caused it? It's hard to say. I need to know a little bit more about it. Is it a bacterial kind of rash? Is it a fungal thing? Is it a perioral dermatitis thing? Is she taking any birth control pills? Where's the rash? Is it around her mouth and nose area, or is it on her forehead? All that matters. Common with women is perioral dermatitis, and a lot of times that can be connected with hormonal issues, the birth control pill, and a big trigger is fluoride toothpaste. So you'd really want to make sure that you have that vector kind of dialed in. All right, very cool. Let me see if I can jump on here and answer some of the questions on Facebook. One sec. Right. Jonathan writes in, dealing with high blood pressure, trying to adjust mineral balance. What's your preferred sodium-potassium ratio? As well as calcium, magnesium. I mean, I don't typically get so wrapped up into the ratio of things, but in general, I like to have a really good mineral support product that's going to be, it's going to have extra like sodium and chloride. I like Redmond's Real Salt. I think it's great. And then we can always add in some extra magnesium. Typically, there'll be a couple hundred milligrams in my multi, and then we may throw a couple hundred milligrams on top of that. So typically, supplementing about 500 or so a day is really great. And then on the potassium side, you want to get about 4,700 milligrams. So if you're not getting that in your food, and we can go to chronometer.com to see how much potassium you're getting, then very simply you can just add in some new salt, add an extra 1,000 milligrams on top of what you're eating. Indoor, I have a couple of potassium support products that have a 10 to 1 ratio, potassium 10 to 1 magnesium, that works great. And that's very helpful on helping if we have any low potassium symptoms. And low potassium symptoms and high potassium can be similar. It can be heart palpitations, anxiety, those kind of things. Could be like spasms and like various fasciculations and twitching. A lot of times that could be magnesium, but if we have magnesium dialed in and it's still happening, it's probably potassium. All right, Alma writes in, 7-year-old with celiac disease having growth issues. Can someone help him grow at a normal rate? Yeah, absolutely. So number one, you got to make sure his diet's dialed in and you're cutting all the inflammation vectors out of the food. That's number one. And then number two, we have to make sure that this, the kiddo's taking digestive support to be able to break down their food. There may be infections going on too that has to be addressed. And then of course we need some kind of vitamin, mineral, amino acid support that's already pre-broken down, because his microvilli are probably really worn out. Those are the little vacuum cleaners in your small intestine that suck up nutrients. And if that's really worn, it's going to be hard for him or her to absorb nutrients out of the food. So we really got to get the diet right. A lot of good bioavailable nutrients. The benefit of that is they're already broken down, so it takes a lot of the stress off the digestive process. Adding in digestive nutrients, cutting out any of the gluten and grains and full autoimmune template, and getting your gut evaluated to make sure there's no other underlying infections. Elizabeth writes back in, do you recommend consuming fermented foods like sauerkraut during the killing phase of your gut protocol? Do you recommend waiting until we repopulate with good bacteria after? I think taking food-based probiotics are fine. As long as it's not gassing you up or bloating you up too much, I think that's totally fine. Great question, though. A couple other things here. Who's next? Elizabeth McLean writes in, is Restore safe as it is from a peat source? As it could be, is it better than probiotics to restore gut function? So the Restore, I think the Restore product by Zach Bush may be what you're talking about. That's like an amino mineral kind of compound and supposedly helps with the gut lining. Again, I've seen patients that are on it that still have lots of gut issues. So I don't think in and of itself is a miracle. I think it's something that we can add into the third R phase, which is the repairing gut lining and repairing hormone phase. I use a lot of my GI Restore, a different product, which has a lot of amino acids like glutamine, DGL, aloe, slippery elm, those kind of things, which are very healing and supportive for the gut lining. Sandra writes in, good morning from San Antonio. Thank you. Spivey, how you doing? Jessica writes in, will Vitax affect thyroid in a negative way? Taking it to help progesterone and have slight hypo. No, I think it would actually help. If you have progesterone issues, progesterone is important for helping the TPO enzyme that makes your thyroid hormone. So if you're supporting your progesterone with the Vitax and it's a nice modulator, then I think it would actually help your thyroid function, Jessica. Alma writes in, what's the cause of chronic thick mucus on the back of my throat? Well, more than likely there's an infection. It could be from your food. It could be from dairy or a lot of conventional food products or inflammatory products, so get that kind of dialed in. Outside of that, it could be an infection. There could be a post-nasal drip, so you want to do a nice little sinus rinse protocol. The Exlea or the Neomed are pretty good. And then sip some ginger tea, maybe even gargle with some apple cider vinegar. That should help. Irma writes in, Candida growth, is it normal to have symptoms when just cutting out sugar and carbs and not taking any killing agents? Potentially. Is it when just cutting out sugar and carbs? Yeah, it's possible, because just cutting out the sugar and the carbs, you can really be killing by starving a lot of these critters out. So yeah, that's very, very possible. Yep. The Korvac writes in, are eggs a good source of vitamin D? I mean, you're going to get a couple hundred milligrams or IUs of vitamin D there, but it's, the best source is going to be sunlight and or supplement. So yeah, still try to get it from food, which you will with whole food, nutrient dense foods like you are, but sunlight, and then this time of year, definitely on the supplement side. Jay Wright, high meat for gut issues. So what's the question there, Jay Wright? Are you saying, is high meat bad or good for gut issues? If you have digestive problems, a lot of times people consuming more meat's harder because they don't have enough stomach acid and enzymes to process it. So you just got to be in touch with how you handle it. If you're having a hard time with the high meat stuff, you really want to look at supporting more enzymes and acids and getting your digestion back on track. Okay, let me see here. A couple other questions. Yeah, I just don't like it. Facebook, it's just too, I gotta squint too much to get in here. What's typical root cause of insulin resistance? What's the best way to fix it without supplements? The root cause of insulin resistance is typically too much carbohydrate. That's the big root cause of that. And make the diet changes and add extra blood sugar supporting nutrients. Okay, cool. Let me keep on rocking, guys. Would raw eggs from backyard chickens be safe to consume? Yeah, I mean, I consume raw eggs for years. Just make sure they're high quality. I mean, the odds of getting salmonella from an egg is super slim. It's like 1 in 60,000 or something. But once you go organic and higher quality, it gets even less. So I think you're fine. Carlos writes in, good morning, Dr. J. Do you have any tips for supplementing for recommendations to lower brain inflammation while healing the gut? Great question, Carlos. Hope you're doing well. Yeah, low-hanging fruits, magnesium. Magnesium helps decrease quinolinic acid, which is an inflammatory compound, so magnesium's great. Dr. Russell Blaylock has done neurosurgery for years. He found that when he gave his patients magnesium pre and post brain surgery, they healed so much faster than his colleagues' patients that weren't doing that. So magnesium's great. Obviously, curcumin, a liposomal source, is going to be awesome as well. Resveratrol is great. Higher dose fish oil and or systemic enzymes taken away from food are all great options. Oliver writes in, after your recent concern of Genova Diagnostics, do you have any concerns of stool testing by DSL, Ubiome, or doctor's data? I had no infections with Genova, but potential pathogens. Yeah, I don't like Genova for stool. They miss infections all the time. Viome doesn't really look at anything infectious for the most part. Sometimes you'll see Blastone H. pylori come back there, but it's just looking at a superfluous amount of bacteria where you don't really even know what to do with it or what to take of it. So it's not really helpful for me on the pathogenic side. That's really where I'm looking at. Sarah wrote in, it's on her cheeks. She's not on birth control. Said it's itchy. What can do topically? So it could be, if it's itchy, it could be psoriasis or eczema. It's very possible. I mean, I would look at making sure she's on an autoimmune template. You can use some nice anti-inflammatory support for that. I mean, you could try what's called the mother of all creams. That's a really good cream. If you go to my site, justinhealth.com/shop, and click on recommended products, you'll see that in there. All right, cool. Keep on rolling. What to do for sweaty hands? It depends. If you have a high amount of cortisol and stress hormone flowing in and adrenaline, it'd be to get that under control. So diet, lifestyle, stress, and adaptogens can be helpful, but get the inflammation down. Inflammation's always a big thing. Is topical magnesium better than using oral mag glycinate? It depends. I mean, some people say that it's better because it can cross the blood-brain barrier better, get into the bloodstream. It just depends. If your gut function is really bad, then maybe doing topical. But most people do great with oral mag glycinate. Gib writes in, are you aware of any cases of people with very low T3, well below the reference range, who can live healthy and symptom-free in that range? It depends. I find if you have thyroid symptoms and you have low T3, remember the bottom, once you get out of that reference range, you're in the bottom 2.5% of the population. So I don't think that's a good thing. Every receptor site on the body has receptors for thyroid hormone. Every cell in the body has receptor sites for thyroid hormone. So I think it's important that your thyroid would at least be mid-range regarding T3. So in that case, I would work on getting that up to an optimal range, getting to the root underlying issue though, and then seeing how we do, and then tapering off and see how much your body can make of its own. It just depends how much autoimmunity's kind of been there and attack things, right? That's really going to be the key issue. Sarah wrote in, you're welcome, excellent. Any difference between gelatin and other forms of collagen powders? Yeah, so like my true collagen it's collagen peptide, so it's already been broken down. We've added proteolytic enzymes to it to break it down. That way you don't have it get gelatinous. It's getting gelatinous because it's not broken down all the way. So I like the broken down version because I deal with lots of people that have gut issues and don't want to put extra stress on their guts. So the peptide form is easier and better. I have a new product out too. It's called True Keto Collagen. It has the same kind of collagen from True Collagen, but I added in coconut colostrum, which is awesome. I added a whole bunch of vitamins and minerals, all really good types. We were able to get activated folate, which is great, methylated B12, and then I added in taurine, which is great for GABA, glycine, which is really good for GABA, and then carnitine, which is really good for fat burning. And then it's a vanilla cinnamon flavor, and it's got MCT oil powder, which is great. So it's an awesome product, very low sugar, I think 3 or 4 grams, and really good vitamins and minerals, and it's a pretty good meal replacement. So I do it at night before I go to bed. I do collagen and maybe 2 scoops of it. It was awesome. Does adding a small pinch of sea salt, Celtic sea salt to drinking water really add minerals? Yeah, I mean, go look at the back of what's in Celtic sea salt or real salt. There's like 72 minerals in it, so for sure. Kevin wrote in, Dr. J, recently starting taking GI Clear 1, 2, and 6 and notice more hair shedding. Is this normal? Hard to say. I mean, you could be having a die-off reaction, so I'd say make sure that you're following the supplement reaction protocol or the die-off reaction protocol, and you're adding in things kind of slowly and titrating it in so you're not creating too much stress in your body off the bat, because you can kill a lot of things fast, and when you're killing things too fast, it's the equivalent of throwing so much trash in your trash bin and you're not taking it out fast enough, so it starts to overflow and accumulate, and that's kind of what happens when you have die-off issues. Moon Goddess writes in, Dr. J, ever since I've been taking methimazole, my stomach is upset and nauseous. What can I do? Also, my norepinephrine and epinephrine went way up. Yeah, so you're on an antibiotic. That's probably the issue. You're killing things off way too fast. Antibiotics have lots of side effects, so it sounds like that's the big issue. Why are you on the antibiotic, number one? Number two, is there some natural herbs that you can do as well to help? And I would add in some activated charcoal, at least that, away from food, and I'd throw in some ginger tea to help as well. That'll be very healing and soothing on your gut lining. Jessica wrote in, any other natural options for progesterone? Well, number one, get your adrenals looked at and supported. That's going to be huge because your adrenals help a lot with that. Also, progesterone tends to go down when you're more stressed. You make more cortisol. Cortisol pulls from progesterone because progesterone is actually a building block of cortisol. So making sure your cortisol is under control will help your progesterone. I even use bioidentical progesterone in conjunction with some of these upstream herbs like chaste tree or maca to help. So we'll use bioidentical progesterone the last half of the woman's cycle to really time it out and to carve it out and make it nice and smooth. That makes a big difference. But you really want to make sure you're getting tested, number one. And number two, you want to make sure you're working with a good functional medicine doc. Could you please explain how parasites and candida make people really hungry? Well, number one, they produce chemicals that make you more hungry because they want your body to eat more crap and junk food and refined sugar because that's their preferred fuel source. It's really simple, it's easy to break down and access. So they create chemicals that do that. And then number two, they are going to rob you of nutrition as well. So it's going to make it harder for you to access all the nutrition you're eating. So then you're not going to get all of it. So your body may still be wanting more of those nutrients. What would cause reoccurring bloodshot eyes? I mean, cortisol and stress can do that. Lack of sleep can do that. That's all possible. What can we do naturally to remineralize our teeth, regrow them essentially? Well, make sure you're getting enough good minerals, right? Of course, calcium is a good one, but there's about 13 minerals that go into your teeth. So make sure you're getting good minerals, sipping on bone broth, getting extra collagen. Again, your bones and your teeth are half protein too, so really good protein, good silica in there as well is really important. I like the toothpaste Revitin, which has some minerals in it. It has some CoQ10. It has vitamin K2, which helps calcium get back into the bone and the teeth. Cod liver oil or higher dose vitamin A is also very helpful. Well, make sure your gut's working well. Make sure you can digest, absorb, and assimilate all those great nutrients too. Moon Goddess writes in, thank you. It's actually methimazole. Oh, methimazole for thyroid. Okay, yeah, methimazole. I was getting that confused with metronidazole. Yeah, so methimazole blocks iodine uptake, so it decreases thyroid hormone. That's typically used for hyperthyroid. So were you diagnosed with hyperthyroid? If not, you want to get that under control. That's an autoimmune issue. So you want to make sure, number one, there's no risk of a thyroid storm. Keep track of your TSI, your thyroid receptor site antibodies, and then check your actual thyroid hormone. If it's good and it's not over the top, then I would be using natural compounds like carnitine and lithium orotate to help modulate that and bring that back down. But you got to get the autoimmunity under control. Make sure you're working with a good doc on that. It's too serious of a situation to be doing it on your own. All right, excellent. Elizabeth Newell wrote back in, the organic acid test shows borderline for parasites. What does that usually mean? Well, the organic acid cannot show parasites. It may show some bacteria in there, but it will not show parasites. So we always go to what the GI map test says first, and we'll look at that in confluence with it. IKO wrote in, after eating pork or chicken, I have a tendency for my wrist to hurt. Although I had an IgG test, and came back very low probability for protein intolerance, any suggestion. Well, I always listen to my body first. So make sure you're going through all the 6 R's, removing the bad foods, replacing enzymes and acids, repairing the gut lining. Foods can become an issue if they're not being broken down properly, or if you're eating other foods as well, that could be a problem, right? So I'd look at nightshades. They're a common offender. Of course, grains too, a common offender with joint issues. Is it necessary to do adrenal hormones to support the adrenals? Can synergy just be enough? Well, I mean, mitochondrial support will help with the mitochondria. Of course, there's nutrients in there that will help with adrenals, because there's B vitamins, which are helpful for the adrenals. We can lessen stress with more magnesium. There's also things in there like carnitine, which help with fat oxidation. Things like creatine help with the mitochondria too. So yeah, I mean, they interplay for sure, but it just depends. Like if I were to look at your labs and look at how your mitochondria function, and then look at how your adrenals are functioning, if your adrenals are just okay, you may be able to get away with it. But typically I see most people have their adrenals are flogged or not functioning optimally. So I want to get people better faster. So we hit both areas up, and make sure we're addressing all the core things that are out of balance. Allie writes in, what makes me flush when I drink even a little bit of organic red wine? It could be histamine. For instance, Asian people have big time problems with alcohol, and part of it is this like 5H2, this like H2 histamine enzyme. A lot of them, I think they take Pepsid because they flush afterwards. So a lot of it could be a histamine issue. It could be a genetic thing where you're missing that enzyme to process the alcohol. And that's going to be more on the Asian side, right? But if that doesn't fit you, they could just be what's in the wine. It could be there's a little bit of gluten in there, which can happen because they line some of the wine barrels with flour. It could be the sulfates that's in there. It could be some of the pesticides that's in there. If it's organic wine, it's probably not the pesticide, but it could be some other kind of compound in there. The question is, does other types of alcohol do it? Like if you drank a really clean Tito's vodka, would that do it? Those type of alcohols are more refined and cleaner, right? They use those to clean wounds in the old Wild West, right? So I would want to know about that first. If not, it could just be an alcohol metabolism issue. What can be done for... Ooh, missed that. What can be done for rashes caused by taking levothyroxine? The JDoc Real Minute. In general, I want to know, how do you know it's the levothyroxine? Was that the only vector that was changed in your protocol and then rashes started? If that's the case, I would look at potentially it being a filler. It potentially being a corn filler in the levothyroxine. I'd look at trying to switch to like a WP or a Nature-Throid that doesn't have any fillers in it. That may make a big difference. Let me just check one thing over here. Awesome. Okay, cool. Keep on rolling, guys. Bernardo wrote in, is it okay to take ashwagandha and rhodiola together? Yep, that's no problem. In my Adrenal Revive product, we have that in there together. Carlos wrote in, I take licorice root and ashwagandha throughout the day while adding maca root into my morning smoothie. Have a negative impact on these two herbs? No, I think that's totally fine. You are totally welcome, Moon Goddess. Oh yeah, you meant the GI map, Liz. So borderline parasites. Yeah, I mean, I can't remember what we've what came back on that test. You'd have to rewrite your question so I don't have to scroll back up. Wes wrote back in, please see my question at 7:48. Not sure where that is at, Wes. You're gonna have to retype that in there for me, Wes. I can't. It's hard scrolling back here. As questions come in, the thing keeps on moving, so it's like a moving bullseye as I try to answer these questions. Let me keep on rolling. Let me keep rolling. What can one do for hirsutism reversal if PCOS and Hashimoto's are diagnosed but male hormones are balanced? So number one, with hirsutism, that's going to be like abnormal hair growth on women. So the first thing is get insulin under control. So your carbohydrates are in check, because insulin will cause increased androgens. It'll do that via upregulating this enzyme called 1720 lyase. Number two is get cortisol under control, because cortisol and stress hormones that are high can increase sugar or glucose, let's say, production, whether it's from liver glycogen or whether it's from gluconeogenesis. So that can then stimulate insulin as well. So you can stimulate insulin from sugar from stress hormones, or you can stimulate insulin from sugar from your diet, and then all of that will then drive more androgens. And then inflammation in your body through inflammatory foods or stress can also drive more inflammation, and that can also drive more androgen growth. And then, of course, over time, As you get more stressed, you can increase prolactin. Prolactin can then mess up your gonadotropic releasing hormone in the brain, which then can dysregulate your hormones, drive more estrogen dominance, and then more testosterone, and then you got this messed up hormonal cycle going on, and it just gets worse and worse. And then you add autoimmunity to it, it gets even worse. So you really want to there's a lot of different things I laid out. So you really want to work with a good doctor that can address all of them and make sure it all makes sense. Lee Bob writes in, what causes the front of the lower legs or shins to go bald? Typically lower testosterone, and also making sure you have good digestion and good absorption of amino acids and fats. That's important, but testosterone too. Claudia wrote in, hi there, can you use rhodiola and bacopa together? Yeah, I have no problem with that. I mean, those are really good herbs. No problem. AJ wrote in, can hormonal imbalance due to infection result in more hair growth? I mean, typically not. I would say typically not unless... you may see it more in a female where the infection is driving inflammation, and the inflammation is mobilizing more cortisol, which is increasing more glucose in the body, and that glucose is upregulating insulin, and insulin's driving up androgens. You may see that more as a female, but as a guy, typically with infections, it's going to affect a lot of the absorption of nutrients, and then you're going to have typically balding. I mean, I see people with parasite infections go bald frequently because it's a big stress, and they're not digesting their fats and proteins, and they don't have enough of that building block to grow their hair. What's your opinion on needing to rotate your proteins to autoimmunity? I think if you love it, rotate it. I think it's good advice for anyone. If you love it, rotate it. Kind of have it on rotation. Don't eat it all the time. I mean, you can have it, a couple days in a row. It's not a problem, but just make sure you're not eating beef every day. Have some beef days, some chicken days, some fish days, some pork or lamb days. That's totally fine. Akbar wrote in, started pregnenolone after a couple of months, and my blue-purple nails came back. That's good. Glad that came back. I know you had issues with your nails going purple to begin with. Never heard of that before in thousands of patients. More than likely something else was going on next to that needs to be looked at deeper. It could be just your gut issues and absorption things, but that typically is a sign of like hypoxia, not enough oxygen. So of course I look at inflammation. I look at thyroid hormone as well. Any good herbs to help with male libido? I mean, tribulus is great. Tongue cut ali is great. You can always do sarsaparilla. Just getting enough zinc and selenium is really good. Horny goatweed's really good. Those are really good. Maca as well. So those are all some good things that you can do to help with that side of the fence. Let me check Facebook for a quick sec. What's typically the root cause of insulin resistance? I think we addressed that already. What's in between collagen type 1, 2, 3, 4? I think it's 1 and 3 are the most common ones. That's what's in my True Collagen product. 2 is another one for the skin as well. In joints, 1 and 3 are the big ones that I like, and in my opinion have the best bang for your buck. And 2, I think, is commonly found in chicken collagen, like the Neocell collagen. The problem with a lot of the chicken Neocell collagen, it tends to be more Tyson-based chickens, so not the best quality chickens. Always great to see you, Doc. Thank you for your great advice. We'll use rhodiola and bacopa together. One remark, try to talk a little slower. Got it. We'll keep that in mind. There's also an option on YouTube where you can make the video go slower too. That's a good option for you. Oh, volume's a little low. I forgot to have my mic up. Darn it. Forgot about it. Thank you. Wish I knew from the start. My mic was just down too low. Rats. Okay, no problem. We got it up. All right, what's your opinion on Agnes van der Planets? Oh, he passed away a few years ago. He was the raw guy, right? He ate everything raw, right? Eggs, meat, chicken, all that stuff. I mean, I think you got to be careful because, number one, without cooking it, you may have some potential infections in it. I mean, the healthier it is, the higher quality it is, that's better, right? That's really good. But there could still be some issues with infections in it or parasites in it or worms. So I think cooking it is helpful, number one. And then number two, I would say you got to really have good enzyme and acid production to make sure you can digest and break down these foods. That's the big issue, right? You got to make sure enzymes and acids are good. If you don't have enough enzymes and acids, remember, cooking is pre-digestion, right? Like prehistoric man / woman, they were able to extract more nutrients out of their food when they can start to cook it. So you pre-digest. So you really need awesome enzymes, awesome HCl. You probably need to really make sure you're chewing your food super, super well. But in general, I would make sure that you're on track with that, that you only do it if it's super high quality, and make sure enzymes and acids are absolutely doing great. All right, cool. Any other questions, guys, before I jump off here and go to a patient? Apologize not having the mic up. Rats. May have to come back and do another Q&A later this afternoon. All right, cool. Anything else? I think I hit all the major issues here. Let me see. Is there anything else that I missed? Okay, yeah. Okay, let me answer Wes' question again. Doc, having trouble handling the Herx reactions, have cut back on GI Clear 5 and 6. We're killing SIBO, yeast, H. pylori all at the same time. My body can't clear detox well using binders. Yeah, so just continue to cut back on the 5 and 6, and just continue to use more binders. I know with some of the issues in the past, Wes, you talked about like relaxation and a lot of the sulfur aminos, and glutamine going to like glutamate. That was being a big concern. Been reading a little bit. Number one, the big things that are going to prevent glutamine from going to glutamate is keeping inflammation low. On top of that is having enough taurine. And taurine is actually made by your body, but when in times of stress, you can deplete it because your body needs more of the sulfur aminos for detoxification. So upping taurine can help, upping B6 can help, and then upping some of the sulfur aminos to help with some of the dopamine and the adrenaline stress issues. So you just have to do that slowly. And then, of course, L-theanine as well. So, I mean, the big things that I would utilize is L-theanine, and you can do it from green tea extracts that are decaffeinated, more taurine, more B6. Those would be big things, and a little bit of sulfur aminos, and just continue to ratchet up the binders and just adjust the clearing herbs accordingly. Just go lower on it and slower if you need. Even take a 3-day supplement holiday if you need there, Wes. Hope that helps. Let's see here. Anything else? L-dactone. Is that like spirulactone? I'd have to look at that. I think that's like a blood pressure medication, but it's used off-label to decrease androgens, if I remember kind of my pharmacy right. If that's the case, that makes sense. So you're just decreasing the androgens. But again, the key issue is you want to make sure you get to the root cause. Is it an insulin issue? Is it a stress hormone issue, right? All those are going to be good vectors to look at. Thanks, Sandra, for giving me feedback on the volume. I'll make sure we have the mic up next time. If you guys don't see the mic or you have volume issues, please let me know right off the bat. I'm using a new software to transmit the video, OBS Studio, so I'm doing that to see if the quality gets better. So let me know what you guys think. I appreciate your feedback. IKO wrote in and started taking high volume B vitamins. Knees started hurting and have never stopped. Could it be from the B vitamins? Possibly. I would do a supplement holiday for at least 3 to 7 days and control all variables that happened recently, supplements and food, and see what happens. Lisa writes in, I still have issues gaining weight. Do some people just need grains to gain weight? No. I mean, the first thing you have to do is, are you eating enough calories as you were before you cut grains out? Number one. Number two, where are your carbs at? A lot of people, carbs are going to be more rich in grains than, like, let's say, a sweet potato or squash. If you look at like one sweet potato versus the same amount of grains, typically you have about up the amount of carbohydrate that's on the safer carb side to max out or to match the carbs coming in from the grains. Keep that in mind. It's the biggest mistake patients make. That's why you need to use Chronometer as a tool. Make sure carbs look good to where you were when you were gaining weight, and make sure calories also look good too. Hope that helps. And again, I only know this stuff because I've done it hundreds of times, right? This issue comes up all the time. So when it's your issue and it happens once, it's easy to be overwhelmed. I've seen it so much, and that's the common thread that's fixed the issue over and over again with my patients. Let's see here. Sherry writes in, my son's 19 at college and has kidney stones. I need some good advice to tell him as to what to eat and drink. So first thing I would do is I would go on a low oxalate paleo template. So try to do only paleo foods, but also low oxalates. Okay, you can Google a handout for that. And then you can also do higher amounts of potassium and magnesium to help flush out the stones. I would do higher dose potassium, magnesium. There's a good product called Potassium HP that I like. Do that while going low oxalate paleo should help fix the problem. Yeah, adolactone is the same as spirulactone. Yep, Okay. Yeah, it's a diuretic. Okay, cool. Yeah, it's also used off-label to decrease androgen. So what I said above regarding the androgens holds true. Is MSM good for lowering inflammation and detoxifying? It is a sulfur compound, so it will help with detoxifying. Would it lower inflammation? Yeah, I mean, if some of the toxins that we're having a difficult time to be cleared are now being cleared, that would definitely help. That makes sense. Josh J writes in, I'm dealing with adrenal issues. Would you recommend a lower carb diet? It depends. I mean, if your diet's been higher carb and more standard American, definitely a paleo lower carb template is great. Vivek writes in, a lot of men on Dr. Berg's live stream were complaining of losing hair when they started keto and intermittent fasting. What's your take on this? So off the bat, it just depends. Some people I find need to make sure they're getting enough protein. They also need to make sure their digestion's good, because if you start eating more protein and fat and you're on a keto template and then you're having a hard time breaking it down, that can be an issue. So make sure HCl and enzymes are good. And some people, they need a little bit more insulin, meaning they're already at a healthier weight. Their insulin's already okay, and then they start dropping it down lower, and that could be a potential issue because you need insulin to get things into your cells. So, of course, I'm thinking potentially too low insulin and potentially impaired digestion. Elizabeth McLean writes in, varicose veins for males with ADD, dairy intolerance, and fat absorption issues. Well, I mean, the first thing with the varicose veins is just your veins are lacking integrity. Fix the gut, fix the digestion, and get more collagen in there so you have better building blocks for the veins. Of course, you can add in some bioflavonoids, grapeseed extract, and you can also add in things like horse chestnut are really good as well. Paul writes in, can you mix your GI Restore with protein powders for leaky gut? Yes, you can. Yep, that's totally fine. You can mix it with a good clean pea protein or collagen or whey if you can tolerate it. That's fine as well. All right, guys, I got to jump off to a patient. It's been real. Had a phenomenal time chatting with y'all. I will be back maybe today or next week. Look for that live podcast on Monday. And head over to thyroidresetsummit.com. Summit's going live in 3 to 4 weeks. Lots of great content. Thyroidresetsummit.com. Thumbs up, hit the like button, and give me a share too. Look forward to connecting with you guys in the future. Take care.